Washington is digging out of its worst blizzard in years. The Senate is slogging through another weekend on health care, but for now, at least, the outcome is no longer in doubt. Senator Ben Nelson of Nebraska announced he would support the bill yesterday. The key vote will come early tomorrow morning, setting up a final vote by Christmas and a tough conference with the House early next year. A lot to analyze this morning, and we begin with one of the president's closest advisors, David Axelrod. Welcome back to This Week.
Thanks, George. Happy to have Chicago weather.
You sure do have it this weekend. Thanks for coming in through the snow. Republicans are already calling this a Pyrrhic victory, and they have a united front against it right now. Here was John McCain yesterday.
Every major reform in American history has been a bipartisan effort. Never, in my experience, has one party attempted to increase the government's influence in 1/6 of the American economy over the nearly unanimous opposition of the other party.
And David, the public seems to have questions as well. We did a poll this week, ABC News Washington Post poll, that showed that 53% of the public think their own health care will cost more if this passes. 55% think the health care system overall will cost more, and only 37% think their own quality of care will be better. In the face of this kind of skepticism, is it wise to ram through legislation like this, such a huge piece of legislation, on a party line vote?
Well, I'd say a few things, George. First of all, you say this is what people think. I think when people see what actually happens after these reforms are passed, those concerns are going to be allayed, and they're going to realize that if they have insurance, they're more secure in their relationship with their insurance company. Their costs are going to go down. If they don't have insurance, they can get it at a price they can afford. It's going to reduce our deficits. It's going to extend the life of Medicare. Medicare recipients are going to get a better deal on prescription drugs and better care. So the reality, I think, will trump poll numbers in the dead of winter as this debate is going on. In terms of ramming it through, we've been talking about this. We've been debating it and considering it for 8 months. The Republican Party has spent a month engaged in parliamentary maneuvers and dilatory tactics to try and prevent a vote. Understand, the big question here isn't whether or not we're going to get a vote, whether this will pass or not. The big question is whether the Republican Party will allow a vote. A majority of senators support this reform, and the Republican Party wants to prevent it from coming up for a vote. I think the American people are entitled to a vote. If you are a person with pre-existing conditions, if you're a small business person who can't afford health care, if you are a person who became seriously ill and was thrown off their insurance because of that, if you're going bankrupt because of out-of-pocket expenses, you need the United States Senate to act.
But most of the changes, even if the bill passes, won't be instituted until after the next presidential election. So you're asking people to take an awful lot on faith.
George, that's not really true. Almost all of the insurance protections, the things that will protect people in terms of out-of-pocket costs, the day the president signs the bill, children with pre-existing conditions will now be, an insurance company can't keep them from joining their parents' insurance policy. People with pre-existing conditions will have a catastrophic plan they can join. And then, of course, when the thing goes fully into effect, everyone will be on insurance. Insurance companies can't ban anyone with pre-existing conditions. But there are a number of insurance protections that go into effect as soon as the president signs the bill. And not to mention, we'll begin reducing that gap in Medicare prescription coverage. So there are many, many benefits to this that go into effect right away, and most of them affect people who have insurance already.
Senator Ben Nelson provided the 60th vote yesterday, said he would provide the 60th vote yesterday, but he also laid out a warning. You've got a tough conference ahead with the House, and here's what he had to say about that.
I reserve the right to vote against the next cloture vote if there are material changes to this agreement in the conference report. And I will vote against it if that is the case.
So he still can hold this whole agreement hostage. Senator Joe Lieberman can still hold this whole agreement hostage, yet you've got progressives in the House and your outside supporters like Richard Trump, the head of the AFL-CIO, saying that if the bill doesn't move back in the direction of the House, they can't support it. How do you thread that needle?
Well, look, this whole process has been like that, George. You know, the president said months and months ago that the best advice he got at the beginning of this process was that health reform would be declared dead at least 5 times before he signed the bill. It's difficult. We're trying to do something difficult. As you know, 7 presidents have tried this. 7 presidents have failed. We've been talking about it for 100 years. So nobody expected this to be easy. But I think that there is a determination in that Congress to get something done here. Everybody understands that we can't sustain the system as it is. It's crushing families and businesses. People need protections against the excesses of their insurance companies. People who don't have insurance need to have insurance, and we need to reduce the overall cost of the system. So I think that despite all these problems, the will to get it done is there, and we will get it done.
But the president is going to have to weigh in. Huge difference between the House and the Senate on taxes. The House has a surtax on the wealthiest Americans. The Senate has this tax on high-priced Cadillac health insurance plan, which the president has said time and time again is a key component of cost control. Does that mean he's going to fight for the Senate bill on the issue of taxes?
The president has made the case that many others have made, that by putting an excise tax on these very high insurance policies on the insurance companies, you'll encourage them to get rid of the feather bedding and the waste and make these policies
so that's
more
essential
efficient.
To the president.
He still believes that, but I'm not going to negotiate here, George. We'll have that discussion moving forward. Right now, our focus is on getting this bill through the Senate and to conference so we can take the final step and bring some relief to the American people.
Senator Nelson also fought hard for new language on abortion that he says would restrict federal funds to abortion. It is now being opposed by Planned Parenthood and the National Abortion Rights Action League. It's also being opposed on the other side by the National Right to Life Committee and the U.S. Conference on Catholic Bishops. Now, you could argue that shows you've gotten something right because everyone on the wings is against it, but it also shows how tenuous the compromise is. Can that center hold?
Well, I think it can, because I think what's at stake is so great that I think that people, you know, Barbara Boxer, who's one of the great advocates for abortion rights in the Senate, was in the room when this was thrashed out, and I think she paid a great deal of attention to the details of this. The president's goal from the beginning was not to upset what the existing federal law was, which is that you don't use federal funds for abortion services. His feeling was this was not the vehicle through which to have that debate. We believe that the compromise that was struck is faithful to that commitment. Now, there are people on either side of the debate who would like to use this process in other ways, and I understand that. But this is not the vehicle for it.
The leader of the pro-life forces in the House, Congressman Stupak, who almost brought down the original House bill, says he's not satisfied. Can he bring down the bill again?
Well, look, this is what the legislative process is about, and everybody is trying to leverage their best position. I think that the compromise that was arrived at was good because it preserved the rights of women to choose and didn't change existing law in a way that one way or the other. And I expect that will be something that people can rally around. But that will be thrashed out in the next few weeks.
You got yourself in a little hot water earlier this week when you called Howard Dean insane.
I didn't say he was insane. I want to make that clear. Howard Dean's a friend of mine. I have a great respect for him. He's a medical doctor, and I know he feels passionately about that. What I said was it would be insane to pass on an opportunity to enact a reform that would have such positive impact on our future and on the well-being of families across this country, and I still believe that. It was probably an unfortunate choice of words.
But what do you say to progressives like Dean who think they've given a lot? They think they've given up the public option, no question about that. They give up the Medicare buy-in, and they see moderate centrist Democrats like Ben Nelson, independents like Joe Lieberman, making demands and getting everything they want.
Well, it's fair to say that when you have 60, everybody makes demands, and this bill has the imprint of 60 members of the Senate, and frankly, Republicans as well. There were 160 amendments in one of the health committees adopted from the Republican Party. But look, Governor Dean's main concern was that he called this a giveaway to the insurance company, but his facts were wrong. The fact is that this bill, for the first time, prohibits insurance companies from spending excessive amounts of money on CEO salaries, on administrative costs, on shareholder profits, so that more money is devoted to patient care. That's written into the bill. We're going to have competition within these health insurance exchanges where small businesses and people who don't have insurance go to buy insurance. And there are going to be a whole range of guarantees. The Patient's Bill of Rights, George, that was fought so vehemently in the 90s, and the insurance companies won, it's embedded in this bill. Every American's going to have greater leverage against their insurance company. They won't be subject to the vagaries of insurance company bureaucrats when we pass this bill. This is a great victory for American consumers, patients, families, businesses.
One final question on Iran. The Financial Times reported earlier this week that they had obtained intelligence documents showing that Iran had been working on a nuclear trigger. These have been looked at by Western intelligence agencies as well. And if authentic, most significant evidence yet that Iran has a nuclear weapons program. Diane Sawyer interviewed President Ahmadinejad about this, and here was the exchange.
Critics of Iran saying this is the smoking gun. Have you been testing a neutron initiator?
I think that some of the claims about our nuclear issue have turned into a repetitive and tasteless joke.
Would you like to see this document? Is it a joke?
No, I don't want to see this kind of document. These are some fabricated papers issued by the American government.
Will you return to talks on nuclear issues?
We have not closed the dialogue window. If they are ready, we are also ready to continue the dialogue and discussion.
Fabricated papers issued by the American government?
Well, of course, that's nonsense. Listen, nobody has any illusions about what the intent of the Iranian government is, and we've given them an opportunity to prove otherwise by allowing them to ship their nuclear material out to be reprocessed for peaceful use, and they have passed on that deal so far. And the international community is going to have to deal with that if they don't change their minds. But
well,
understand,
it's pretty
George,
clear, though, that he's not going to change his mind. He says he's willing to talk more.
We'll see about that, because there seems to be division within their government. Understand, George, what's happened. When we came to office, Iran was united and the world was divided in an approach to deal with Iran. Today, Iran is bitterly divided, and the world community has come together, and the president has been a big force in bringing them together. And I think that the world is united and is willing to take additional steps if the Iranians don't
So bottom
turn
line,
around.
if they don't turn it around by December 31st, sanctions will come?
Well, we're talking, plainly, there are going to be consequences if they don't turn around.
David Axelrod, thanks very much.
Good to be with you.